Welcome back to the Indie Wellness Center YouTube channel. My name is Brittany Catterjohn and I'm the registered nurse.
And I'm Robin Ildib, nurse practitioner, owner of Indie Wellness.
As promised, we will be talking about a thyroid panel today, the thyroid panel. Oftentimes if you go to your doctor and you say you want your thyroid checked or they want your thyroid checked, they'll just draw a TSH. And this isn't giving you the entire picture, so if you are coloring in your coloring book and you only use one crayon, you're not going to see the entire picture. You need a lot more crayons, probably.
Right.
So, to do this in a fun way, I'm sorry.
Go ahead.
Okay, so to do this in a fun way, I'm going to play Polly again, the patient, and Robin here is going to play doctor, and we are going to show what typically happens in a doctor's office when you're getting your thyroid evaluated. So I'll get my glasses here. Robin's glasses. Polly glasses.
To clarify.
Okay, and begin.
Hi, Polly. How are you doing today?
Hi, Robin. I'm good. I'm excited to see what my results are.
So I think we talked at your last visit. You've been a little tired, constipated, cold, cycles have been irregular, all of those things. Is that correct?
Yeah, and I watched a YouTube video last week, and I can totally relate to all these symptoms for hypothyroidism. So I'm excited, hopefully, to reach some sort of conclusion.
Okay. Well, I looked over your labs, and I'm happy to report that your labs are completely normal. Isn't that great news?
Well, no, because there needs to be an explanation for how I feel. I'm having all these symptoms. There's no way I'm normal.
Are you sure maybe you're just not getting enough sleep or you're just stressed out with your children or something? Maybe that's...
I mean, I have all those things too, but it's more than just that. This isn't normal.
Are you sure that you're not just really stressed or that's not causing the issues of being tired and all of that?
Well, are you sure you checked everything?
I did. I checked the TSH. Yeah. Are you questioning me? Just kidding.
Yeah. So that type of conversation is not uncommon because...
I'm shaking the table.
Oh, sorry. Because typically what's drawn is a TSH, and you need more than a TSH. What else do you need, Robin?
Yeah, so in our practice, we draw a TSH, a free T3, a free T4, then also check some other vitamin levels too, ferritin level, because you need enough iron for your thyroid to function well. I check zinc, selenium, and other those kinds of things. And we check thyroid antibodies to make sure you don't have a condition called Hashimoto's, which is the most common form of hypothyroidism, and that is an autoimmune disorder where your body doesn't recognize itself, and there's antibodies around your thyroid destroying the thyroid.
Oh, okay.
So that can give you a whole lot more information than just a TSH.
Right. The TSH itself, that's thyroid-stimulating hormone. So all that's showing essentially is whether or not the pituitary is sending messages to your thyroid to release what it needs to release for you to feel good and for everything to function normally. After that, right, it goes to T4.
And then it has to convert to T3.
T3. And then T3, unbound T3 is what you need to function.
Well, and that's the reason we draw a free T3, because we're not interested in a total T3. Part of that is we want to find out what's bound and active and available to you to use. So if your T4 is not converting over correctly to T3, you're probably going to have those symptoms that she mentioned earlier, like this week and in the other video that we did before.
Right. And then also with the T3, Robin talked about how she draws a reverse T3. So when it gets to T4, it can go to either T3 or reverse T3. And if it goes to reverse T3, your body can't use it. It's bound up. So you need the free T3.
Yeah, and you will have some reverse T3. That's normal. That's a normal part, but we just don't want it to be too high. So that's why your thyroid can look fine, or your TSH can look fine if it's going to the reverse T3 pathway. It looks like it's doing what it's supposed to be, but in times of stress, it will go down that reverse T3 pathway. So we want to try to give you, also we'll work with your adrenals and all that sort of thing. So it's not just so simple as just to draw a TSH and be told it's normal, because it very well might look normal.
Right. Up here can be normal, but what happens after it may not be. And this number is an inaccurate representation always of what happens after. That may be totally confusing. If it is, feel free to comment, ask questions, give us a call. Subscribe to our channel.
And we can draw it all out for you. Sometimes it's easier to see it on paper than it is to try to describe it.
Exactly. So I think that's it for today.
Okay, great.
Thanks for joining us, and we'll see you next week.
Take care.
Bye.